Hi, this is David Unsworth, English editor of the Pan Am Post. Today we'll be talking with Michael Cannon, Director of Health Policy Studies at the Cato Institute in Washington, D.C. He has been described by the New Republic as ObamaCare's single most relentless antagonist, and provided legal arguments in the Supreme Court case King v. Burwell. Michael, thanks for being with us today.
Happy to be here.
So, to begin with, why has Obamacare been fundamentally unable to increase choice and competition as President Obama promised?
Well, because the model that Obamacare follows is one of restricting choice and restricting competition, telling consumers you cannot buy only the health coverage you want. You have to buy much more. You have to buy an entire list of benefits the government wrote into statute and that legislators wrote into statute, and then a list to which bureaucrats can add every year. So that increases the cost of coverage, reduces choice by reducing the variety of plans that are available to people. And it's all really done because what the authors of Obamacare tried to do is provide subsidies to people with expensive medical conditions, but hide those subsidies from the people who would be paying them. And they did that by telling insurance companies, you must charge healthy and sick people the same premiums if they're of a given age. That reduces the premiums for sick people by increasing them for healthy people. And so that too increases the cost of coverage. It ends up reducing competition and choice. The problem is that those subsidies, or that hidden system of taxes and transfers is not hidden enough. Healthy people realize that their premiums are going up and they can wait until they're sick to buy coverage, which is something that Obamacare allows them to do. So healthy people figure, well, you know what? We're not going to buy coverage, even though the government is penalizing me for not buying coverage. The penalty is less than the premiums that they're expecting me to pay. So we're not going to buy coverage. Enough people do that, the premiums go up, even more people decide not to buy coverage. And right now, what we're facing next year in the United States is a situation where Obamacare is apparently going to destroy health insurance markets in many parts of the country. Already in parts of Tennessee, well, I should say that in 70% of counties in the United States, the Obamacare health insurance exchange has only 2 carriers providing coverage on that exchange.
Sure.
In 30% of counties, there's only 1 carrier. And so in Tennessee next year, now that an insurer called Humana has announced that it will leave the Obamacare exchange, there are 16 counties in Tennessee where there will be 0 insurers on the exchange. 43,000 Tennessee residents, many of whom have expensive medical conditions, won't be able to buy any coverage at any price. So that's the effect that these rules have on competition. They actually suppress it and ultimately can destroy the market for health insurance.
Do you buy into the argument that Obamacare was intentionally established to fail in order to force us down the road to single payer?
Well, I don't think so. I think the people who designed Obamacare thought they were clever enough to make this work. They had some experience in Massachusetts, where they had enacted a similar law, and the market has not collapsed.
Under Governor Romney.
That's right, under Governor Mitt Romney. So the same people who put that law together wrote Obamacare, and so they believed, perhaps not unreasonably, maybe from their perspective, that this would not happen. But, you know, the United States is a big country. It's bigger than just the state of Massachusetts. It's more diverse than the state of Massachusetts. And so things haven't worked out the way they planned. It turned out they were not as clever as they thought. There are some people who thought, you know what, if this doesn't work out, it's okay because then we'll get single payer. Paul Krugman is one of these people. And so I think there was a contingent of support for the Affordable Care Act made up of people who said, you know, maybe this will fail, and that's fine. There's some inherent contradictions here, and if it does fail, no big deal. We'll support it, and maybe even some of them were hoping that it would fail. But I don't buy that the people who wrote it designed it to fail.
Fair enough. Tell us about your role in encouraging states to refuse to set up their own exchanges as part of a long-term strategy for repealing Obamacare.
So we have a federalist system in the United States where the federal government and state governments are independent sovereigns. And under the U.S. Constitution, the federal government cannot force states to implement federal laws. They can create incentives and the line gets blurry, but states have the right to say, no, we're not going to do this. And then the federal government has the power to implement those laws itself if the state does not. And that's the approach that the Affordable Care Act's authors took. They said that when it came to the private health insurance overhaul, they told states, we want you to implement these regulations. We want you to change your laws so that your laws reflect these regulations. We want you to establish a health insurance exchange, which is a government bureaucracy through which insurance companies and consumers had to do business if they wanted to get hold of the federal subsidies that the Affordable Care Act creates for health insurance. And yet 38 states said, forget it, we're not going to implement an exchange. And that was really remarkable. A lot of people didn't think that was going to happen. A lot of people just assumed that all states would fall into line, but there was a lot of resistance among the states.
And you've been described as pivotal in New Hampshire, for example, in New Jersey, as, for example, in New Hampshire, the Republican legislature was already preparing the legislation to establish their own exchange. You arrived to speak to the New Hampshire legislature. They changed their mind.
There was a lot of misconceptions about how this law worked and whether establishing an exchange gave states more power and control over how this law would operate in their state. A lot of Republicans wanted to establish an exchange because they figured that would give them more control over how this law worked. My role was to go to the states and explain to them how the law works, that no, you really don't have any more control. This is a federally driven law. They just want you to implement their law for them. They chose this structure because if it were all run from the federal government, they realized that would engender a lot of opposition. It would make transparent what they were trying to do, which is federalize healthcare. And so my role was just to go to states and explain that that's what's happening here. And if you do establish an exchange, you'll get all the blame if things go wrong, but you won't get any control or any power to make things better. And so a lot of states saw through that. There's also just a lot of inertia on the part of states who decided that they would let the federal government implement its own laws and let the federal government take the credit or blame for its own decisions.
Why do the Republicans currently appear to be so divided and driftless regarding repeal and replace? And why are we constantly hearing in the media that for example, Rand Paul has repeatedly referenced what he terms Obamacare light?
Well, that's because, if you'll recall, the plan on which Obamacare is modeled, the law that Massachusetts enacted in 2006,
my state,
under a Republican governor, Mitt Romney, with the help of a conservative think tank, the Heritage Foundation. Obamacare itself has a Republican pedigree. It was basically, the idea came from the Conservative Heritage Foundation, and a lot of Republicans supported the idea until Barack Obama took it up and pushed it after he became president of the United States. So even though it has become Republican orthodoxy that Obamacare is a bad thing, Republicans have never made healthcare a priority. They've never really delved into the details, and a lot of them don't notice when someone else puts it's such a problem that when Republicans introduce a plan that resembles Obamacare in almost every particular, a lot of Republicans will fall in line behind it just because it has a Republican plan at the top of the page. Just because it is being introduced by a Republican, they think it's okay. Some Republicans, however, are not that, or pay more attention to healthcare or are not that gullible. They are people like Rand Paul, people like Raul Labrador, a member of the House of Representatives from Idaho, people like the House Freedom Caucus in the House of Representatives. They look at the particulars and they say, wait a second, this preserves this. They're looking at, a bill that the House Republican leadership is putting together. They say this preserves the central architecture of Obamacare. Why are we proposing this? Why are we saying anything nice about this approach at all? Because this is what we've been railing against for 7 years. Did we only oppose Obamacare because it was being introduced by Democrats, or do we really believe that it is going to make health care worse, make it less available? That's the fight. That's where the division comes from in the Republican Party right now. That's the fight that they're having right now. And it's kind of troubling because you've got some heavy hitters, maybe even President Trump, who are lining up behind the House leadership plan. It remains to be seen whether that carries the day. But if it does, Obamacare will achieve immortality because Republicans will become invested in the powers that Obamacare created and making them
It
work.
is indeed troubling.
And the opposition for Obamacare will end on that day.
In a recent article, you discussed the evil genius of the millennial mandate. Explain how obligating insurers to cover children up to the age of 26 was part of Obama's scheme to hide the true cost of Obamacare from the American public.
So this is a provision of Obamacare that supporters claim is popular, but actually is not. Because here's how it works. The provision tells insurance companies that you have to cover, if you cover dependents, people's children, you have to cover those children all the way up to age 26. That means that they have to cover them well after the point at which these kids should have graduated from college. And for parents, for young adults and parents of young adults with expensive medical conditions, this is often a godsend. But let's keep in mind why this became necessary, or why people thought it was necessary. In the United States, the federal government favors employer-sponsored insurance by giving it preferential tax treatment.
Sure.
Tax treatment so preferential that you might end up paying twice as much for similar coverage if you want to buy coverage directly from an insurance company. But the federal government is favoring employer-sponsored health insurance, a type of health insurance that disappears when you change jobs, or disappears when you are no longer a dependent of your parents. So when you become a young adult. No one in their right mind would buy coverage like this unless the government were pushing them to do it. So this problem of people, of young adults, with expensive medical conditions, all of a sudden becoming uninsured and having a pre-existing condition is a creation of the federal government. Were it not for the federal government intervening in markets this way, parents would buy coverage for themselves that would cover their children up to age 18, and then they would buy a rider on that insurance policy that covers their children and any medical conditions they develop before age 18 in perpetuity for the rest of their lives. And those kids would pay not cancer patient premiums if they had cancer, but healthy patient premiums. Insurance markets have developed this provision, and children would be covered by this and wouldn't lose their coverage and end up with a pre-existing condition as they do under the government-created employer-based system. Now, I said that, so given all the damage that the federal government has done to the health insurance, to the security of access to care for people who develop expensive conditions with their children, it is, to many parents and young adults, a godsend that the ACA provides or requires employers and insurers to cover them up to age 26. But that coverage is not stable, and it's not stable because it comes at a cost. It has been estimated by economists that one provision costs workers $1,200 in reduced wages. Whether or not you have a dependent, it reduces your wages by $1,200. What that means is that, and so when you ask workers, when you ask voters, do you support this provision, 70% of them say yes. But when you ask them, what if it reduced your wages by 55%? What if you reduce your wages by $1,200? 55% or so of them say, no, I oppose this provision. So support flips to opposition once you ask people about how this provision actually affects them. And there is an interesting dynamic where people under age 26 who are generally not paying for this coverage, not seeing their wages reduced, they support it, even after they find out about the cost. But after age 26, people age 27 and above oppose it. So this requirement is itself vulnerable to being repealed because the public oppose it, so it's not a secure way of providing coverage to these people. The only way to do that is to undo the damage that the federal government has done by favoring employer-sponsored insurance.
What lessons can we draw from Vermont's recent experiment with single-payer health care, the so-called Green Mountain Care?
So for those who aren't familiar, Vermont is a very small, very left-leaning state. It is not a liberal state in the international sense of that term, although they would call themselves liberal. They're very anti-liberal when it comes to healthcare. They want a heavy or a very dominant role for the government in healthcare. They want the government to guarantee access to care for everyone, finance access to care. But even in left-wing Vermont, when the government tried to enact a single-payer system, they couldn't do it because the taxes were so high that the public rejected it. The cost in higher taxes of a single-payer system were so high that not even left-leaning Vermont would swallow those taxes.
And even Governor Shumlin.
And that is even though the federal government would pick up part of the cost and pass part of the cost of Vermont's experiment with single-payer off onto other states. Vermont only had to raise taxes to cover a fraction of the costs of their single-payer system, and their voters still rejected it. That is how unpopular single-payer is in the United States, that not even Vermont would do it even when they only had to pay a fraction of the cost.
And even Governor Shumlin, who had championed the plan and who had put together the plan in collaboration with MIT economics professor Jonathan Gruber, even he recognized and said to the Vermont public that the costs would be so burdensome to Vermont's taxpayers and small businesses that it's just completely unfeasible.
That's right, and that's why that effort died, and is unlikely. And it died in Colorado as well. They had an initiative on the ballot in Colorado to try to create a similar system. Voters rejected that as well. And why the only way I think that we will ever get a single-payer system in the United States is if it is financed with deficits. If the federal government says we will make future generations pay for it because taxpayers don't want to pay for it. So the most important thing to my mind that the federal government can do to prevent the expansion of socialized medicine in the United States and to roll back socialized medicine in the United States would be a balanced budget amendment that requires the federal government to pay for all of its current spending with current taxes, because then taxpayers will get tired of paying for all of this wasteful government spending, and they will demand reform.
Speaking of ACA architect Jonathan Gruber, he's generated quite a firestorm by referencing a quote-unquote lack of transparency and the quote-unquote stupidity of the American voter in relation to Obamacare passage. You've just referenced a balanced budget amendment. What else can the conservative and libertarian movements do to sway public opinion in order to reveal the truth about Obamacare's defects?
Well, we've just done some polling at the Cato Institute that points to the answer to that question, which is that opponents of the ACA, supporters of a free market healthcare system, need to talk not just about the cost of government-run healthcare, but also the quality of care. The most popular part of Obamacare, if you believe most polls, are the provisions that tell insurance companies they cannot discriminate against patients with expensive medical conditions, pre-existing conditions. If you just ask voters, do you support banning discrimination against people with pre-existing conditions, 60, 70, 80% of voters will say, yes, we support that. But you're only asking about the benefits or the supposed benefits of that regulation. If you ask about the costs, if you tie the benefits to the costs, such as by asking voters, what if those provisions reduce the quality of care? Would you still support them? Support flips to opposition. When we asked voters about those provisions and only asked about the benefits, they supported them 2-1. But when we tied the cost to the benefits, 2-1 support flipped to 2-1 opposition. So it's really the quality of care and access to quality care that drives public opinion. And if you want to educate people about Obamacare, if you want to turn them against this law, you need to talk about the quality of care that voters and their loved ones will receive under this law, and how this law degrades the quality of care.
In your mind, what can the healthcare industry do to increase transparency so that consumers have true choice and competition?
Well, we don't need to look to the industry to do this, because the industry will do it automatically if the government gets out of the way. The government in the United States prices and quality so opaque is by changing who controls the money, taking our healthcare dollars away from us, spending those dollars itself, or giving those dollars to employers to spend on our behalf. In the United States, consumers really only control 11 cents out of every dollar spent on healthcare, if that. But meanwhile, the federal government directly controls 51% of healthcare spending. Employers control 21% because the government gives them that control over that money. And then the government indirectly controls another 10% or so by mandating that we give our money to health insurance companies. If you eliminate those mandates, if you eliminate the tax preferences that give employers control over 21% of U.S. healthcare spending, that's $700 billion per year, more than the GDP of many small countries, and let consumers control that money. Or if you have the U.S. Medicare program, instead of giving a government-defined package of health insurance benefits to people, just give people the cash and let consumers control that money. Let them all choose and purchase their preferred health insurance plan. Then if health insurance companies and healthcare providers want to get that money from us, they're going to have to give us the price information we demand. They're going to have to give us the quality information we demand. Right now, people don't care about prices and quality as much as they would if they were spending their own money, because they're spending employers' money or they're spending the government's money. They will demand quality and price information when it's their own money, and they will get it, or else providers will not get that money from them.
So, Michael, I have a close friend who is a physician in Connecticut, and he asked me to ask you a question, if you don't mind. His question is, people who cannot afford health care are going to avoid inexpensive primary care and end up in the expensive emergency room, and the government is going to pay. Wouldn't it be more cost-effective to pay for inexpensive primary care?
There are all sorts of claims made in health policy debates that spending money on preventive care will save money on acute care by avoiding expensive medical interventions later on. There are very few forms of preventive care that actually meet that cost or that criteria of reducing spending. Vaccines may be one of them. But most forms of preventive care result in higher spending. Now, they might improve health, and they might be worth doing, but they don't reduce spending later on. And so many people spend so much money on colonoscopies in order to catch one cancer that would have killed someone, and catch and stop one cancer that would have killed someone, that you end up spending more money with greater screening than you do than you would spend just on treating that the patient where that tumor, the colorectal cancer tumor, emerged. Now, you might say that, well, it's worth it if we catch it and prevent that patient from dying. But there aren't any studies to show that expanded colorectal cancer screening reduce all-cause mortality. So even if you do catch that cancer, it's not clear that we're going to be able to save that person's life. So there's a lot of question about the even the health benefits from expanding screening and other forms of preventive care.
And finally, what words of wisdom would you impart to Latin American governments as they seek to improve the quality of healthcare while controlling the costs?
The most important thing that any healthcare system can do for vulnerable patients is drive prices down as far as possible. And the best tool, and that's for two reasons. One, because then fewer patients are vulnerable if prices are lower. And the patients who still cannot afford the medical care that they need, that population is smaller, but everyone else is paying so much less for their medical care that you will have a wealthier society that will be better able to care for those who cannot provide for themselves. And the most effective tool we have for driving down prices is to let the consumers control the money. Stop taxing people to fund these expensive government-run health and social insurance schemes. If you can't get rid of those schemes immediately, just have them subsidize people by giving them the cash and letting them purchase the health insurance and medical services that they want and not the ones the government wants them to purchase. They will do a better job of avoiding unnecessary services, of buying necessary services and bringing down the cost of necessary services so that fewer people are falling through the cracks of your healthcare system rather than more people.
Michael, thank you so much for being with us. We really appreciate your time, and hopefully someday we can have you back again in the future.
I would be pleased to do it.
Thank you very much. Take care.